about to give you information about lipid profile test information. I am teaching you about it, but first of all, if you are new, so please subscribe my channel, press the bell icon so now I start my topic about lipid profile. A lipid profile or lipid panel is a panel of blood tests used to find abnormalities in blood lipids such as cholesterol and triglycerides. Concentrations. The results of these tests can identify certain genetic diseases and can determine approximate risks for cardiovascular disease, certain pancreatitis, and other diseases. Lipid panels are usually ordered as part of a physical exam along with other panels such as the complete blood count and basic panel components. A lipid profile report typically includes its five reports: low density, LDL level, LDL level, total triglyceride, and cholesterol. It is five panels of lipid profile, and LDL level is not usually actually measured but calculated from the other three using the Freud equation. A laboratory can optionally calculate the two extra values from the report. Number one, view very low density lipoprotein VLDL. Number two, cholesterol LDL ratio. Procedure and indication of lipid profile. I have some guide about it. Lipid profile, it is a blood test of cholesterol. Cholesterol related to heart. Recommendations for cholesterol testing come from the adult treatment panel ATP and III guidelines and are based on many large clinical studies such as Framingham Heart Study. For healthy adults with no cardiovascular risk factors, the ATP III guidelines recommend screening once every 5 years. A lipid profile may also be ordered at regular intervals to evaluate the success of lipid lowering drugs such as statins. It is a drug named statins. In the pediatric and adolescent population, lipid testing is not routinely performed. However, the American Academy of Pediatrics and the National Heart, Lungs, and the Blood Institute NHLBI recommend that children aged around 9 to 11, it is the children age, be screened once we sever cholesterol abnormalities. This screening can be valuable to detect genetic disease such as familial hypercholesterolemia that can be lethal if not treated early. Traditionally, most laboratories have required patients to fast for 9 to 12 hours before screening, and however, studies have questioned the utility of fasting before lipid panel, and some diagnostic labs routinely accept non-fasting samples. And its methods, lipid profile methods, though I have discussed you. Freud wide. Typically, the laboratory measures only three quantities in lipid profile. Number one, total cholesterol. Number two, LDL. Number three, triglyceride. A typical procedure used by the Hannah's 2004 uses the following measurement methods. Total cholesterol is measured using a mixture of enzymes and fix and esterase converts cholesterol esters into cholesterol and free fatty acid. Then an oxidizes the cholesterol producing F2O2 side product that changes the color of the dye. The amount of oxidation can be precisely quantified by light absorbance at 500 nm. Number two, quantities. Triglyceride concentration is also measured using an enzyme mixture. A lipase release glycerol from the molecules which gets oxidized by another enzyme. While producing H2O2, the same color change follows. Number 3 is Blattwardin methods. FDL is measured in two steps. First, a special reagent is added to the serum that binds APOB containing lipoprotein particles and shielding them from the enzymes in the next step. Then a mixture of P-galated enzymes is added with dye. The chemical reaction is the same as the total cholesterol measurement except that the enzymes are blocked from acting on non-FDL lipoproteins by the reagent and their own PEG tails. For the 3 data LDL may be calculated according to Forward-Wars equation. Uh, LDL is equal to total cholesterol, negative FDL, negative triglyceride over 5. Here's value we measure some. LDL level from two same 3 data have been proposed which yield some significantly different results. VLDL can be defined as the total cholesterol that is neither LDL or nor LDL. With that definition, Freud was and a yield of VLDL is equal to triglycerides over 5 is equation values. The alternative calculations of the mentioned above may yield significantly different values for VLDL level. The Freud-Wald method is reasonably reliable for the majority for patients, but is notably inaccurate in patients with hypertriglyceridemia. And it's also underestimates LDL is equal C in patient with low LDL/C, and it does not take into account intermediate density lipoprotein. And now we discuss the direct of lipid profile. What is it? Every part of the lipid panel that can measure directly using ultracentrifugation, which is the gold standard. This type of measurement involves no errors from estimation and can also measure LDL and C/C and LPA levels. And fully direct measurement is more costly, however. Laboratories may also be proprietary tests for direct chemical LDL/C will require no prior separation by centrifugation, and these tests are not yet standardized in US and Europe and lack validation. वासलाम अल्हम्दुलिल्लाह ठीक जी कर लियो and its implications. The test is used to identify and close. So friends, was my topic. I hope you like and give you some more information about lipid profile. If you like, also please subscribe my channel, press the bell icon. So now we complete our topic about lipid profile. Next video is very special for you. Inshallah, I create and give you much information in my next all videos. So now you give me permission. I am go take care. Allah Hafiz. We will meet our next new best topics. Take care. Allah Hafiz.